So when you're going to have any surgery, especially the insertion of a coloplast tightened penile prosthesis, there's going to be a lot of questions that you need to ask and that you will think of. And one of them is, what are the clearances that you will need prior to surgery? What are the medical clearances? I will always have you see a medical doctor, what we call a hospitalist, to get your pre-op clearances. You might need an EKG, an updated chest x-ray, and he or she will look at your list of medications, see which of those you need to continue. Maybe one needs to be discontinued, such as an anticoagulant, a blood thinner. But we will make sure that you are adequately screened and that any questions about what medications you take, which ones you stop, what you need to do or not do will be adequately answered at least 1 or 2 weeks prior to surgery. As far as confirming any insurance coverage, we have staff at my office that will go over that with you. I mean, the surgical procedure is covered by Medicare and most insurance companies, but there might be 1 or 2 who may not cover it, or you may have an insurance plan that there might be some out-of-pocket issues, such as a copay. But we have office staff that will go over that with you way before your surgery. So rest assured, there will not be or should not be any sudden surprises after surgery. This may not be considered as major as a surgical procedure such as, let's say, open heart bypass surgery, but it's still a surgery that requires time under anesthesia, on average 45 minutes to an hour, give or take. So because of that, you definitely are going to have a significant other or friend, take you to the hospital and wait for you and then take you back home after surgery, because this is typically, in my hands, an outpatient surgery, and you cannot drive yourself, nor can you take a taxi or an Uber. So once we've had the consultation, we're ready to proceed. We walk out of the room, we start scheduling surgery. As I'm putting the orders for surgery, in the computer, we give you instruction sheets, the do's and don'ts. This will list in a typed fashion of things you need to think about, such as, what medications you might need to continue or stop. But also, we provide you with instructions on using a type of antibacterial soap called Hibiclens that I typically have you scrub your whole body with every morning for 4 days, including the 5th day, which would be the morning of surgery. I like for patients to use a vacuum erect device as much as possible if you have one, just to try to maintain some penile length, because over a long period of time, with the absence of erections, as you probably know, you do tend to lose some girth, and you definitely have lost some length. And if you haven't, we want to try to prevent that as much as possible. The hospitalist or the medical doctor who does your preoperative clearance to go over your medications more specifically, he or she will address your medications, your medical diseases such as blood pressure and whatnot, and whether or not you need a chest x-ray or EKG. One of the things that is a really big no-no is you don't need to help me or the operating room staff by trying to shave or, the genitals a day or two, early, and definitely not the day of the surgery. Unfortunately, that's been shown to actually increase the risk of infection. Now, once you're asleep in the operating room, the nurse will shave any hair that's involved in the surgical field that I will be involved with around your genitals, and then they will do a special prep that will get rid of any bacteria. But let us do the shaving. Thank you, but please don't do that before the surgery. Like all surgeries, we always ask you to stop eating and drinking at midnight before the surgery. Now, when you get your preoperative clearance by the hospital physician who's going over all your medications a couple weeks before surgery, he or she will probably look at everything, and if there's a medication that they think you do need to take the morning of surgery, then they will tell you that very clearly and tell you to do that with sips of water, but not or, orange juice, milk, or coffee. Sometimes when the surgery occurs later in the afternoon, there might be a concern about your diabetes, your sugar, if you're diabetic. And again, they may have to regulate those medications and make an exception to the rule. But the norm is nothing after midnight. Now, once in a blue moon, not very often, a patient may say, is there anything special I should pack, the night before or the morning of surgery? Not really. I mean, 99% of the patients that I do a penile implant in go home the very same day. So I wouldn't really recommend you bring anything, out of the ordinary. You don't need an overnight bag or toothbrush or toothpaste or anything like that, because I plan on you going home the same day as surgery. So a quick overview, if you're watching this video, on, what can I expect, the day of surgery? Well, depends on, what time of the day, 7:15 in the morning or 11 or 2 in the afternoon, are you having surgery? But essentially, you will be told by my staff what time to come to the hospital. And typically it's about 2 hours before the operation. You'll go into a pre-operative care area where a nurse will come by and start an IV, have you change clothes before that, put on a hospital gown and maybe some warm socks, and put a cute little hat on you and start asking you questions. Go over your history and physical, go over your medications, make sure you haven't eaten after midnight. What are your allergies, if any? What are your concerns? And make sure that the consent form for the penile implant goes along with why you think you're there to begin with. And then, of course, I will walk in and make a few jokes and try to comfort you and lower your anxiety and ask, if there are any, last minute questions that you have. And no matter how many times we've addressed issues along the way, even maybe a week or two beforehand in my consultation room, you should ask any question you have, because the only dumb question is the one you don't ask. And maybe it's something you didn't think about. Maybe it's something we didn't, talk about. And I'll remind you of when your follow-up is, when you're getting the JP drain out, when the staples come out, and your follow-up. And so we'll address all that briefly, sign your consent form. Anesthesiologist comes in, gives you some medicine that kind of relaxes you, and you start going into twilight, and we start doing your implant. Before any surgery, most men and women have a little bit of anxiety and nervousness. I mean, we wouldn't be human. I've had several surgeries in my life. I never get scared about them because I work in this industry. In fact, I kind of enjoy seeing, the scrub techs and nurses that I work with if I have to have surgery, and kind of see how they're doing and make jokes with them. But for the majority of you, you're not in this industry, and it's very common to have some anxiety and nervousness. Now, right after you see me, and along with the nurse, and we sign your consent form, we don't want you sedated on any medications, because we have to have you mentally, intact to sign the consent form. But as soon as we do that, anesthesiologist or the CRNA, the nurse anesthetist, will come by and give you some medication through your IV, which will very quickly make you very relaxed. But as far as beforehand, there's really nothing we can do about it. Just, relax the night before, have a very quiet evening, a very relaxing evening. Just don't labor on it. Don't get scared. Just think in your mind what a life-changing surgery this is going to be for you and your partner, and that, after 2 weeks recovery on average, you're going to be so happy that you went through the penile implant. So I would just say, in the days leading up to surgery and the night before, just relax and chill the most you can, and just be so happy that your life is going to change, hopefully so good and so well. So if you have any questions at all before the surgery, please do not hesitate to contact the office. You may get a response from one of our nurses. You may get a response from our medical assistant, but 95% of the time, those questions to those assistants that work with me, they're going to send those questions right back to me, verbally and or by electronic medical records. and we will be able to address those questions. Most of the time, there's not many questions, but there might be something. And again, I say this all the time. The only dumb question is the question you don't ask. Do not be embarrassed. If it's on your mind, ask the question. If you have a question about finances, that would not go to me, and that would go to the financial advisor, and you would be directed that way. And then obviously the day of surgery, any last minute questions or concerns that you and or your significant other have, I will address those right then before you take you back to the operating room. So rest assured, any question you have, we will get those answered. Just contact the office, please.